Day-to-day life usually starts pretty early. We come in at, it starts at 07, so we're actually here just a little bit before everybody else. What we do is we get, first thing is a teleconference. So we sit down and we have all the medical planners within our region. So we're region 1, and we're communicating the plans for the day. We're communicating information that was passed last night so we can have actions to work with. So now we know where to go with this new information. And then we just kind of create a plan for the entire day of these are the taskers that need to be done and then how we're going to get it done. And then after that, it's a series of other teleconferences where we collect information from other resources to have an idea if we're on target. So as a hospital corpsman, our primary job is to provide medical assistance, medical support, and in this area now, medical liaison. So my number one job here is going to be the health and safety of every single Marine, airman, and soldier, including sailor, that is within our compound. So they start to feel sick, they start to have, or they get an injury, then what I do is I do an initial assessment. I make liaison with other MTFs if they need to go to another MTF. I communicate up the chain of command to a provider to kind of get ideas of this is what it sounded like, this is what it looks like. He either confirms and directs for, for continued or higher echelon patient care. On top of that, also have to do daily temperature checks, which are randomized and to and from. So a lot of personnel that are leaving here get their temperatures checked to make sure we're not sending anybody who might be asymptomatic to another location and might spread it there. Whenever they return, just in case, we check to make sure that we maintain the cleanliness of our little bubble. To other medical kind of professionals, that might seem a little bit excessive, but I'm a firm believer of preventative medicine. So I try and identify temperatures earlier rather than later, which is why we do it so aggressively. And what we would do is, part of my policy, because I wrote the policy, is to, if anybody has a temperature of 99, they get a daily temperature check. The minute they hit 100.4, they're in isolation. They're going straight into isolation, and then that requires me to monitor them 3 times a day, feed them, give them anything that they need, continuously communicate up the chain of command to providers. We have to do a CCIR for it, everything like that. So it's maintaining the health and safety of everybody within this compound, and to make sure that if it does start to spread, that we quickly identify, isolate, and treat. Because of the certain jobs that I've had before, I mean, I'm a field medical technician by trade, and that involves a lot of emergency medicine, preventative medicine. Part of our rotations is also within hospitals. So there's that patient care and then the SOAP note aspect of just, sick call and clinical care. So what that does to get me prepared for this is especially the preventative medicine part, because that's something that you really need to be cognizant of when you're going into a pandemic area. Understanding how a virus or bacteria can float from one person to another, from one person to a surface, from my mouth to your area where you can then absorb it, and then it becomes an issue. Understanding that flow and understanding how it's transmitted allows me to identify risks, mitigate those risks, and put implementations or controls in areas to prevent that kind of thing, which is why masks are definitely there for everybody's protection. What I can do to help kind of prepare the personnel here for going out there, absolutely. So one of the things that we did do before coming up here was I identified personnel that would be traveling around a lot, CG, for example, Chief of Staff, other colonels that would be going out and visiting these high-risk areas. So we did an N95 fit testing on them, and it's the full fit testing. We have the N95s, we put them on, we showed them how to mold it to their face. That's just the fitting part. The fit testing part, we now have a hood that we put over their head that has a little hole in the front of a plastic clear face shield. And what we do is we spray a small fine mist of kind of a saccharine kind of, not really saccharine, it's more of a sweet kind of flavor to it. So whenever the mask will actually filter it out. And what happens is if it doesn't filter it out, then there's a leak. So that's what we're trying to identify. Is it fitting correctly enough to where it would actually protect you against that environment? So another thing that we did was we gathered some PPE. We brought gloves with us in case there's ever times that we have to break out the gloves and use the gloves, primarily for hygiene and cleaning areas. Those that do field day around the building should be wearing gloves. Surgical masks for those that forget their cloth masks, and it's a good backup to have. So there's a lot of things that we do to prepare for that, and giving them an education on how things are transmitted. So a lot of people don't understand that. I was at Walmart a couple of days ago going grocery shopping, and there was people walking around wearing these big giant paint filter masks. They're actually N100s. They're a little bit more filtration than the N95s, but their eyes weren't covered. And I thought that was very unique, that you're wearing this big giant mask that's meant for paint booths, but your eyes are not covered. So one of the tricky things is not only can it just get into your mouth, but it also gets in your eyes. So if I cough in your face and you're wearing an N95 mask, you're going to think you're good because the N95 mask is going to do the job. It could still be absorbed through any kind of mucosal area or lacrimating area, which is your eyes. So if you go down to the UAMTFs, you'll see all the providers that are treating the patients. N95s, face shields, gloves, gowns, booties, scrubs, the whole 9 yards. And it's that level of prevention is what is needed. It means a lot, actually, to me, to see that the way that the civilian community tries and does treat, and what they do is amazing. But when you start incorporating the DoD into it as well, that DoD medicine muscle very rarely gets flexed. The earthquake in Haiti, the hurricanes that we typically respond to have been onesies and twosies, very small units going and responding. USNS Comfort, USNS Mercy being deployed a couple of times in the past decade is a great show of what we're capable of doing. But what we have going on right now is a tri-service, full-on fight. And nothing makes me more proud to see that. To see all of us coming together. Yes, we may, give each other a hard time. You're Air Force, I'm Navy, they're Army. But that right there shows me that not only can the fighters come together, but military medicine coming together and fighting all this, not just here, around the world. That right there makes me very proud to be in military medicine. So, for a Marine Corps command to go into a pandemic and do what they do, I understand it's C2, but the group that we came with, incredibly smart, very good at what they do. To learn this, this is a medical mission. This is a medical mission, and for the Marine Corps to sit there and say, "We've got this, let's go." That right there, that is pride. It makes me proud to be with the Marine Corps. It makes me proud to wear their uniform, because out of everything I thought they would have definitely just kind of turned away from, a medical fight, and to be a part of that team to go running into that fight. That to me is really amazing, and that is really awesome.